Dr. Jay Montgomery joins us. He's a cardiac electrophysiologist, also professor of medicine at Vanderbilt University, and he joins us now on Outkick 360. Doctor, thank you for the time.
Thanks for having me.
So let's start with this. You've seen video of what happened, and we're telling any medical expert we talk to, obviously, you're not there to treat the patient, but just watching from the outside, an insider watching from the outside, you've seen things like this before, and I'm sure that you have an opinion on some possibilities of what could have happened in this incident with Damar Hamlin. What are some of those possibilities, Doctor?
Sure. So anytime an athlete has an arrest during practice, during a game, and when I say an arrest, what I mean is suddenly the heart rhythm becomes abnormal. The heart is quivering instead of beating in a organized fashion. The result of that is that you really don't have blood pressure to your head. You pass out, and it can be fatal, obviously. So anytime there's an arrest during activity, like sports, there's a few different possibilities. One is that it could be the result of what we would commonly call a heart attack or a myocardial infarction. So that really means that there's a blocked artery to the heart. One of the arteries that supplies blood to the heart muscle, it gets blocked. That part of the muscle isn't getting that blood flow. It starts to undergo injury. In that setting, you can then have a cardiac arrest. The two things are not the same thing, but that can lead to an arrest. That's relatively uncommon in young athletes, though it is possible, especially if the arteries take an abnormal course, abnormal path through the heart, and that would be something that you'd be born with. It's a much more common cause of an arrest in an older person. In an athlete, the most common thing would be hypertrophic cardiomyopathy, which is a genetic problem. It's what Reggie Lewis died of, among many other athletes that have more recently often been resuscitated from an arrest. And so that is certainly possible here. And there's other genetic rhythm problems as well that can cause arrests. What makes Damar's episode a little bit different was that he wasn't sort of just running down the field. As we all seen, there was an impact, I think, with T. Higgins' shoulder hit him generally in the center of the chest, maybe left side of the chest, which brings up actually a less common cause of cardiac arrest, something called commotio cordis. There's definitely no guarantee that that's what caused this, but this is consistent with that, just in the way he got hit. In this, when someone has commotio cordis, two things have to happen. You have to have an impact right over the heart, and it has to happen at just the wrong time during the heartbeat. It's a very narrow little window during each heartbeat when the heart can be hit in order to cause this. And that research was done in Boston about 15 or 20 years ago, kind of showing how that happens when that window is. And then that, if you get hit just wrong, you go from normal rhythm to cardiac arrest. The heart's just doing this, no blood pressure, you pass out. And, if somebody doesn't do something, that's a fatal problem.
And Damar Hamlin, 24 years old, when you talk about commotio cordis, is this something that happens typically younger people, older people? Where do you see this? And just how uncommon is this? Obviously, we've never really seen anything like this watching a football game live happen. So it has to be pretty rare.
It's very rare. It is even more rare in adults than in children. Presumably, if Damar was 48, it would actually be even less likely, assuming that's what this is, than if he were 24. The thought is that the chest wall has to be soft and compliant. And by that, I mean the ribs have to sort of be able to be compressed. And the older we get, sort of the more bony our ribs get, the less they sort of get squished easily by impact. Commotio cordis is very uncommon in general. It is definitely more common in 10-year-olds than it is in 24-year-olds, but still, these are rare events that many people, go their whole careers and never see at all. I've taken care of one patient who had commotio cordis, it was actually a 22-year-old. I'm an adult cardiologist, so of course I wouldn't have seen the children, but and that was actually an impact from a lacrosse ball that got run over by a huge lawnmower and happened to hit him in the chest just wrong. Similar thing. Thankfully, that had a good outcome.
So can you walk us through the research for this? You mentioned it took place in Boston. I hear a story like this, and I'm thinking, the medical community just amazes me that you can come up with explanations for things like this that I would never even think as a possibility for an incident like this. What went into the research to discover causes of this condition?
Well, I'm somewhat sorry to say the research for this is basically there were anesthetized, swine, pigs that were sort of held in place, and they were hit with baseballs at various timing and various velocity. And so that is how we know what we know about commotio cordis.
And the research showed that you could stop the heart if hit at the exact
Absolutely.
right time. Yeah.
Yes. And if it was at the right velocity and timed just right with the heartbeat, and of course with an EKG, like an electrocardiogram, they can set it up to time it a little earlier, a little later, and they kept doing different versions to figure out at this velocity with this timing, what happens. And they figured out that with the right timing and with the right velocity, which I think the velocity was in the 40-mile-per-hour range for a baseball, but I mean these were like 45-pound pigs. That was sort of the sweet spot.
Dr. Jay Montgomery, our guest, cardiac electrophysiologist and a professor of medicine at Vanderbilt University. Doctor, there's a lot of discussion about the safety of football, the safety of the sport now, and there has been. There are plenty of other things to point to as far as safety is concerned and the focus. But in terms of this, listening to you, like a guy mowing his lawn and it hits, a lacrosse hits someone in the chest, or your baseball, I'm assuming, can cause this as well, or a car accident. In terms of the sport itself, this was, well, I mean, we've never seen anything like this, but this can happen in everyday walk of life, not just a contact sport.
Yeah, it actually is much more likely in sports, though. The most likely scenarios would be lacrosse, I think, is number one. Baseball, less likely with sports with bigger, larger things impacting you. The smaller sort of heavy projectiles seem to be what cause it. However, it's rare in any sport. In lacrosse, I think, I'm not a lacrosse expert, but I think it's fairly common for lacrosse players to actually have a chest shield. Mm-hmm. And I think some people do that for baseball, not anybody that I know personally, but for this reason. But it's a very rare thing. If we wanted to talk about safety of football, this is not on the top 10 concerns. If you were trying to say, what are the things we can do to keep people safe who are playing football, this is not something that across large populations is going to be the biggest risk to somebody playing football.
I get, and hearing the description of it, yes, and hearing the description of it, are you surprised that it doesn't happen in football the most? Given this was a very routine play. And for us to see this, we're like, what is going on here? We didn't know this could occur in this way in the middle of a game.
Yeah, I think part of it is maybe just that there might be a lot of reasons for it. Part of it, I think, is that at least with the pig research, the velocity of 45 miles per hour, and that's for small pigs. Mm-hmm. Nothing is traveling that fast in football, actually. One person hitting another at full speed is only going to be 40 miles an hour. But I mean, that's going to be very uncommon to get hit right in the chest. And I mean, for adults, I suspect that the optimal velocity would be higher, though that research has not been done. That was part of what we were seeing with I wrote up a report about the 22-year-old that we saw, that this lacrosse ball was probably going, for a variety of reasons, we think about 200 miles an hour. And that doesn't happen in football. Even if the football is thrown, of course, it could be going 50, 60 miles an hour. But I mean, it's soft, right? Mm-hmm. So the football itself isn't going to cause that type of impact. Also, if you get hit by somebody's shoulder, it's bigger. It just impacts a much larger area, and maybe that's protective compared to a lacrosse ball or baseball, where the ball may be this big, but the area of impact is probably quite a bit smaller than that. So I think that's probably a lot of the reason we don't see it. The velocity and then the size of the actual footprint of the impact itself.
And you've got obviously some experience with this with the 22-year-old that you've referenced with the lacrosse ball. What is protocol when treating a patient like this? I think a lot of people just saw, not knowing, oh, he's intubated, that must be a bad sign, but that's not necessarily the case. There's some reports coming out from the family that while they can't get into details, there's been some encouraging signs. We're now, 36 hours, getting close to 48 hours away from the injury. Walk us through what the process would be like after an injury like this and where we could be in the process right now, if you could.
Sure. So if somebody has a primary arrhythmia, which I'm assuming that this is, but I do not know that, then that means that the first problem that he had was that he had a cardiac arrest, not that he had a heart attack, didn't have a blocked artery. It didn't start out with, poor blood flow to a part of his heart. The first thing that happened was his heart started quivering, a cardiac arrest. The number one thing that we want to happen is chest compressions, hands-only CPR, followed by a shock, a defibrillation by an AED at a professional sports event. At a high school sports event, there should be an AED. That is number one. That's what we want to happen first, as soon as possible. And I don't know the exact details of what they did for Damar, because there was, the team surrounded him and stuff. So they did all of those things, exactly what order and all that stuff, I can't tell. Once a patient is resuscitated with an AED, some of the time, if it happens very quickly, they may wake up, literally on the field, wake up. In that case, you wouldn't end up with a breathing tube. Most of the time, the person at that point has been down long enough that they're not going to immediately wake up. And they would put a breathing tube in probably before they put him in the ambulance, most likely.
How many?
If they think, go ahead.
Oh, no, go ahead. Please finish. This is fascinating based on the details of the process.
Yeah. So if they think that he was down for several minutes, meaning without a pulse for several minutes, which is my understanding in this scenario, then they might elect to sort of do what we call targeted temperature management, where they sort of try to prevent his body temperature from going up with special things, because there's conflicting evidence that protects the brain after an arrest like this. And so there's some chance that in a scenario like this, maybe not this scenario, I don't know, they may elect to keep him sedated so that they can control the body temperature and have everything sort of controlled. In that scenario, leaving the breathing tube in is something that's done as a choice. You leave it in because you're sedating him, because you're trying to control these other things. And so, it may be that the reason that he's still unconscious and with a breathing tube is because the treatment team thinks that's the best way to give him the best chance for a full recovery. In the process of all this, sometimes people can have other things that happen. So that might be, liquids from the stomach can sort of regurgitate and end up in the lungs, unfortunately. That can cause lung problems. Sometimes in all of the different things that happen, people can end up with infections and stuff like that. These are the types of speed bumps that people sometimes encounter when they have something like this happen, something that is not the original problem, but something that follows from it.
And certainly not just with Damar, but with anyone that's gone through this process. What are things, doctor, that you would be looking for as the next step of recovery, the next solid and encouraging sign that things are going well?
Yeah, there's basically two things here. One is that the organs from the neck down tolerated all this okay. And so that includes the lungs, which I know I heard at least that he was on an elevated level of oxygen, then they brought it down. That's good. ideally he wouldn't have required a high level of oxygen at all, but it sounds like he did, at least briefly. But hopefully all of those organs are working okay, kidneys, et cetera. Sometimes they can sort of take some hits from this, but in a young, healthy person, usually that stuff bounces back okay. And then the second thing is, the neurologic recovery after an arrest like this. So when someone is down for a period of minutes, if they've got chest compressions, if they get shocked by a defibrillator, what we're hoping then is that the brain was getting enough oxygen through that process that there's not any sort of long-term damage to the brain. Often in these scenarios, if somebody has an arrest that's witnessed, which this one was witnessed by as many people as maybe ever in history, and someone gets there with a defibrillator, with the AED, they often make a full recovery. But there's all these different types of speed bumps that can happen that can make that, more or less likely.
With your 22-year-old patient that got hit by the lacrosse ball at 200 miles per hour from the lawnmower, was there someone there to witness the incident?